Welcome to Mind Balance Yoga. I'm Dr. Sarah Morrow. I'm a licensed psychologist. I specialize in child and family mental health, and I also teach therapeutic yoga. And in these classes, my hope and my intention is to bring in some education and some skills training to really empower people to understand how the mind-body system works, including your brain and nervous system, and most importantly, where we have choice, what we can do for ourselves to cope more effectively in life and reduce our experience of suffering. So normally I have certain topics I teach about, but given the situation that we're all living through right now, I feel it's really important that this be a space where we can kind of keep it real about how hard this is and figure out how can we best get through this experience and take care of each other, take care of ourselves. So right now, there's a global shift in the world occurring. A very important moment in history is unfolding. And all of our norms, our personal norms, our societal norms have suddenly changed. And we don't really have a way to control the situation we're in or know what's going to happen. We can't anticipate what this will really look like after some time passes. So in that, it can be really hard to feel relaxed and at ease because things are so unstable and insecure in our world right now. And while this is part of human life, it's not something we're ever comfortable dealing with because we like to have consistency and predictability to know what will happen and how. So what we're facing right now is this sense of a threat to our species, where at the same exact time across the entire globe, all human beings have to face a shared threat to our safety and survival. And in that is an opportunity for us to, in this modern era, be able to understand what's happening in other parts of the world, know where things are heading, be able to collect data and do our best to prepare and plan for this difficult time. But it's also hard because in all that knowing, we have to realize the amount of suffering going on in the world. And that is difficult to really accept and feel. So in talking with some of my friends this week, I think there's a sense of kind of on the surface level saying, I'm okay, I'm doing all right, I'm getting through this solitary life at home and coping, I'm healthy. But when we really kind of go a little deeper and pause and really go inward and notice, you might be surprised to feel that there's this discomfort that you're just carrying with you, a sense of tension and a bit of anxiety that's just lingering there. And I think it's hard for us to want to feel that because we can't really fix it or change it, and it's uncomfortable. So there's a reason that we feel these things. You know, your nervous system, which is made of your brain, spinal cord, the nerve pathways that go throughout the body that communicate about what's happening in the world around you. They communicate that back to the brain through these little chemical messengers that kind of are little information packages that tell the brain what's happening, and the brain then tells the body what to do in response. But your nervous system really has one primary function, and that is your survival. That is the number one goal of your nervous system. And so when we are facing this threat, this sense of danger that could potentially come into our homes or our families, it certainly creates some discomfort because our nervous systems know about illness and threat, and it creates a sense of anxiety within us to know that we may not be able to protect ourselves. So when this occurs, you're nervous. When you have sense of threat, you get anxious, and your body goes into this very quick fight, flight, self-protection stress response. And that drive is meant to help you do whatever you can to avoid harm and stay alive. And what happens when these things occur is that we can get so overwhelmed or so frightened through danger that it can actually leave an imprint in the body. So in in the trauma world, we know that when we go through traumatic experience, it changes our physiology. It changes your brain, your sense of self-awareness and connection with reality. It changes how your nervous system functions, so you stay a little bit stuck in a stress response all the time. We know that that impacts overall body health across the lifespan. We also know that the hormone system changes and we get these elevated stress hormones, and we just don't feel good through these changes that happen in the body. What's interesting in yoga is that they've known about these imprints left by emotional stress and trauma for a long time. The word in yoga is the term samskaras, which is this acknowledging that our emotions do not just happen and go away necessarily, but really threatening experiences that causes a lot of fear or a sense of trauma actually physically change the body. And what we're learning more and more through the study of trauma is that we have to use embodied experience, so actually moving the physical body in order to really heal those imprints left from trauma. And so yoga is a wonderful ancient philosophy, really the first psychology about how do we have choice to reduce our suffering. And what we're learning through modern science is that a lot of what the yogis figured out proves to be really true. So we're now using yoga to help war veterans, emergency first responders, prison populations, even children who we know have childhood trauma. We're incorporating therapeutic yoga into some school interventions. And so finally, we're sort of emerging from this idea we should be able to just be tough and not let trauma affect us and kind of move on. And we're realizing that we have healing to do when we go through these tough experiences. And I'm really drawn to this field of collective trauma that I've been learning about more recently, which is this idea that we are not just, our bodies are not just, haven't just learned from our own direct experiences, but we also carry knowledge of our ancestors written into our actual genetic code. So one thing that happens in trauma is that your gene expression then changes. And we know those changes in your genetics are inherited and that trauma can actually be, in a sense, passed down generationally. And so we're really now looking at these more global traumas that have occurred or societal traumas that have occurred. And we're using these embodied experience practices through yoga and also things like rhythm, music, dance, singing, really stimulating these healing energies in the body. And we're seeing the brain can heal and the nervous system can come back to balance and our health risk factors from trauma can be reduced. And so when we come into this space and we're trying to take an hour for self-care, the intention is not just about exercise. For me, the intention is for us to take the time to go inward and to recognize those deeper layers of feelings that we may have pushed down a bit or suppressed a bit because they hurt and they're hard to go towards. But from this awareness we do in these classes, the hope is that we can soften into that emotion, into that hurt, and breathe and give feedback to the brain and the nervous system that in this present moment, I am safe, I am well. And we do that through shifting the posture out of stress response. So in danger, we self-protect here. We never want to get injured in our vital organ region. And so our stress kind of holds us in this body. And so in yoga, we're trying to open through the heart center, lift through the heart, relax the shoulders back and down away from the ears, smile and soften tension from the face. Yoga philosophy believes that we hold emotional tension and stress or trauma into the hips and the pelvis. And so in therapeutic yoga, we often do a little bit more hip opening work. Of course, everything we do here is also meant to boost your immune system and support your body's ability to be resilient should you find yourself dealing with illness. So I also learned a new breathing technique this week, and I really want to bring that into this class because this breathing technique called Pratiloma is a way that we can actually increase the strength and resilience of our respiratory system. And of course, this threat we're facing with coronavirus is really about the dangers of how our respiratory system can get overwhelmed from these infections. And so everything we can do to be, nourishing and stimulating good respiration is going to be protective should we find ourselves ill. And so this breathing technique, Pratiloma, I learned about it through an Ayurvedic doctor, John Douillard. He's an Ayurvedic physician in Colorado. And I was really fascinated by all the research behind this breathing technique. If you want to learn more, I did post his educational video to my Mind Balance Yoga Facebook page. So that would be a really great thing to listen to if you have some time. But what he explains is that, we breathe, luckily, involuntarily, unconsciously, we just breathe, luckily, on our own. However, over time, we tend to get this laziness or this weakness in the diaphragm muscle. And part of that comes from emotional stress. And we definitely see this change in trauma. And so the diaphragm is essentially a slightly inverted bowl shape. Its job is to separate your digestive system from your circulatory system. As we inhale through the nose to the belly, as we should breathe in a healthy way of breathing, the diaphragm contracts downward. And as the diaphragm pulls down, the belly will push out. But what that's doing is actually creating a physical space for the lower lobes of the lungs to receive the breath. And that is so important because what we know is that through trauma, during emotional stress, if we're in danger, we go, we breathe mouth to chest quickly, and we breathe up high and shallow in the lungs. And when we can breathe with the diaphragm leading the breath from the nose low into the lungs, then what happens is those lower lobes are where we exchange most of the gases. So where we can absorb more oxygen, release more carbon dioxide. And the lower lungs is also the area of the body where those nerve endings, when we take that nice deep breath, those nerve endings link to your parasympathetic relaxation response. So when we are young, happy, relaxed, we breathe with the diaphragm guiding the breath, and we breathe low in the lungs naturally. But when we are stressed or if we've experienced trauma, we tend to lose access to that diaphragm breath, and we tend to breathe into the upper lobes of the lungs, which is detrimental to our overall health and, of course, our sense of well-being in the body and in our mood. And so this breathing technique, what it's doing, Pratiloma, is really almost weightlifting for the diaphragm muscle. So the technique, I like to explain breathing techniques here while we're talking, so you don't have to think much about this when we're doing this in meditation. But this practice is fairly simple. We take a finger to either side of our nostrils. We close the nostrils about halfway to restrict the airflow coming in. And as we breathe in through the nose, what we can sense is the diaphragm having to pull downward. And then we just release the nostrils, hands to heart, and we just fully exhale. Dr. Douillard recommends adding to this practice what's called kumbhaka, which is a slight breath retention. As we inhale, we hold the breath in for a moment. As we fully exhale, we pause and hold the breath out before the next breath comes in. And he explains that this slight breath holding actually helps oxygen move into the tissues and cells of the body rather than just flow through the bloodstream. So we know that this breathing technique is really beneficial for all kinds of health ailments. If you have asthma, any respiratory difficulties, it's helpful for heart disease, gastric reflux. And so it's also really protective should you go through respiratory infection. And so we're going to use this breathing technique today to really have a sense of what it feels like to breathe this way, to really feel the diaphragm guiding the breath, working to breathe effectively. And I would encourage you to practice this a little bit every day. The recommendation is to do 10 of these breaths and then rest and repeat that 5 times. They recommend you do this in the morning as well as 50 more breaths in the evening, but not on a full stomach because, the diaphragm is pushing into the digestive system. And so you may not do, 50 breaths in the morning and the evening, but even if you could just stop and remember to take 3 or 4 of these breaths throughout the day, I think it would be very beneficial. You'll probably find you get a little bit lightheaded with that breathing technique. And so by all means, if you feel any dizziness, just go back to regular breathing. Okay, so today's practice, I hope, is going to be an opportunity for all of us to just pause and go beyond this surface level kind of autopilot functioning we're in, and really notice and really feel the reality of what our species and our world is going through currently. And from that place of feeling, I think we have to work towards acceptance, knowing that infectious disease is part of human history. That's part of why our nervous system is anxious, because we have had adaptive learning through prior humans who have gone through similar challenges. And so we want to notice the anxiety and the stress there, but also come to kind of zoom out in perspective and have more acceptance. We want to really allow ourselves to feel compassion. It can be painful to really let ourselves feel compassion for the pain in the world, but it's really essential that we let ourselves experience that and have compassion towards ourselves and our own struggles as we go through this chapter of life. And then, of course, I'm always cueing you towards gratitude. What can we smile about, be thankful for, really see the good in whatever we can find as we go through this time. I'm so grateful for technology. I'm so grateful that I can still continue to work and offer my teaching. And I know the sound and lighting is not perfect here, but I think this is a wonderful space for us to come together and hopefully as a small yoga community, just really be able to take this time to take care of ourselves, so that we are in a more resilient place to hopefully effectively take care of others in our lives. Okay, so we're going to practice, and I have to relocate, so I'm going to scoot myself back, so just bear with me for a quick moment. I always will recommend that you have a blanket to sit on, so this helps you just be in better alignment in a meditation posture and feel more comfortable when you're in sitting. And so wherever you find yourself, if you maybe take a pillow or a folded blanket or even a big beach towel under you, that will just help you be more comfortable here in meditation. Traditionally, we take one foot to the center of the body. The second foot rests roughly in front of that foot, so the knees are wide, hips more open. But if that's not comfortable, then just bring the feet a little closer in into a cross-leg position. Okay, so from here, we level the pelvis. We feel this strong grounding foundation through stability in the legs. And then we begin to rise upward, lifting through the spine, rising through the crown of the head. And as we come into this tall, alert skeletal body, we work to soften the muscular body. So rolling the shoulders down the back, perhaps bringing hands to the thighs and drawing those hands in to help the shoulders just fall away at ease. And then, of course, closing our eyes is beneficial to inner awareness, but you're always welcome to keep just a soft gaze on the floor in front of you. The sound of my tiny singing bowl is your cue to come to your first intentional deep breath, to really draw all of your awareness into the present moment. Deepening the inhale, breathing from nose to belly. Exhaling completely, releasing the full volume of the breath. And beginning to follow the breath, attempting to slow down the speed of the air flowing in, and then slowing the exhale even more. And drawing awareness inward, just begin to scan through the body, just noticing how the body feels, aware of any areas of tension, discomfort, and offering a softening or relaxing or even self-massage into that area. Noticing the emotional energy within the body without expectation or judgment, just aware of the energetic state, the emotional place that the nervous system is in. Moving beyond surface level awareness, looking a little deeper. Bringing awareness to the mind and just noticing any thoughts that are arising. And as you notice a thought, just inviting it to pass by. Coming back to the breath and back to the body again and again. Making sure to soften through the jaw. Allow the eyes to be completely at ease. And perhaps enjoying just a hint of a smile throughout the face. A little loving energy. Breathing in, feeling the belly rise. And breathing out a slow breath. Slow down and soften. Witness. Be present to all that is, including pain, fear, and trauma. Connect with another who is going through this same thing in this same moment, restoring our connectedness. This allows us to find our way into who we really are and create ripples out into the world where others can do the same. Transformation starts with a different wisdom, with a slowing down. Philosopher Terry Patton. Allowing ourselves to pause and find stillness and to soften into silence. Following the breath, aware of the whole body. I'll now invite you to try a few rounds of Pratiloma breathing. On your next inhale, turn palms to face up. Exhale, draw hands toward the face, taking one finger to each outer nostril. Closing the nostrils just about halfway, begin to breathe in from nose to belly. Feeling the pull of the diaphragm, drawing the breath in with a slight resistance. Bringing hands to heart, smile to the face, exhale completely, releasing the breath. Pause with the breath out. Hands back to the nostrils, inhale. A deep, slow breath, drawing the diaphragm down, expanding to lower lungs, hands across the heart. Gentle smile as you exhale fully. Pausing with the breath out. Again, inhale, nose to belly. Hold the breath in, hands to the heart, smile to the face as you exhale. Releasing the breath. And one more time, deep breath in. Feeling the contraction through the diaphragm, hands to the heart. And exhale. Releasing the breath completely, pausing before the next breath in. And now returning to natural breathing, prayer hands at the heart. Taking a moment here, just notice any sensation that those breaths may have created. A little lightheadedness perhaps. And just be curious about that feeling. As we come here into Anjali Mudra, it's our opportunity to set our intention, to visualize the direction we would like to head in our health, our emotional well-being, and our resilience as we face this stress and challenging time. Take a moment just to really acknowledge some of the struggle, some of those deeper layers of stress or anxiety, or even this collective trauma that we may all be feeling. And just acknowledging that hurt, that struggle, allowing yourself to feel it completely. And then zooming out to a larger awareness, realizing we are not alone in these feelings, in this challenge. We are together. We are here for each other. And we all can understand because we all have the same vulnerability and a shared pain rippling across our entire world. So finding acceptance of the present moment, breathing in a deep compassion for all those struggling, who are unwell, who are scared. And then pausing to find some points of gratitude in your life, in your present moment. Perhaps grateful you're well enough to be here today in this practice. Perhaps grateful for your family's safety and health in this moment. Deeply appreciative to all the doctors, nurses, hospital staff, scientists who are working diligently to discover every means of support and help possible to help our planet, our country move through this challenge and suffer as little as possible. So just seeing yourself moving forward more aware and taking the time to feel the tension that you might be carrying and to allow yourself time to take care of yourself through embodied practices, through mindful movement. See yourself able to successfully lower that activation of your nervous system and bring yourself back to balance and toward emotional well-being through intentional self-care. Taking a deep breath in, big breath out, slowly opening the eyes, releasing hands to the legs. From here, go ahead and bring your knees together, draw the legs out in front of you, and take a moment here perhaps to massage a little bit of the kneecaps, get a little blood flowing back through the legs. And now from here, really lift through the heart. Set the feet actively. So imagine you could sort of press your feet into a wall in front of you, spread the toes wide, draw the toes back towards you, and from this tall body posture, just squeeze energy of the legs in towards each other. Engage the core muscles. And now point the toes low, as if you could press the tips of the toes to the floor. Feel some stretch through the tops of the feet, ankles, the shins. And then press the heels away, draw the toes in towards you, and again, lifting the heart. Roll the ankles a few times each way, finding that full range of motion. And then inhale, lift up, and exhale, begin to walk the hands forward. At first hinging from the top of that hip crease, keeping the back body strong, heart and chest lifted. And then as you find that point of stretch in your forward bend, beginning to soften. So relaxing through the back of the knees, perhaps even a little bend to the knees, turning the palms to face upward, dropping the chin down and rounding the shoulders, coming into a resting forward fold. So when we're a bit overwhelmed and the mind is full of stressful thinking, we come into resting forward bends with any leg position. It's a pose of self-awareness, a way for us to realize where we're at, what we're feeling, and from there, see our choices, how to respond. Sinking in here, just knowing you're breathing, aware of thoughts in the mind. And then fingertips drop towards you and press down on an inhale, roll yourself up, head comes up last. And then from here, go ahead and step your right foot in. So as you might notice, I'm not mirroring these classes because I don't have a live audience. So when you record yoga, typically you just verbally describe what you are doing. So we'll step the right foot in. This is for our Marichyasana twist. And so you're welcome to keep the foot to that inside of the left knee. Otherwise, if you want to go deeper into this twist, step that right foot across to the outside of the left leg. From here, inhale, lift strongly through the left arm, really lengthen through the side body, and then begin to twist to the right, plunging the elbow to the outside of the right knee, The right hand will come behind your hip for support. Inhale, lengthen upright. Exhale, twist, turning to the right, pressing the elbow and knee into each other and feeling this twist into the low belly. Only turning your head gently, always keeping the neck comfortable and safe. Really breathing low, exercising that diaphragm muscle. On an inhale, bring hand to knee, and exhale with a long spine, untwist, coming forward once more. And then from here, step the right leg down, step the left foot in. Again, option to keep that foot to the inner knee or to go further, step across to the outside of the right leg. Inhale, reach strongly through the right arm, lengthen through those right side ribs, and then begin to exhale and turn. Now, if you don't want to go this deep, just bring the hand or elbow to that knee. Otherwise, plunge that elbow to the outside of the left knee. Your left hand will come behind your hip to support your height and your spine. Inhale, lengthen upward. Exhale, begin to twist. Pull the belly in at first to really access this twist into the low back and the belly region. Keep that right foot active, pressing that right leg out away from you, and turning the head only gently. Breathing into the belly. And on an inhale, lengthen upright, hand to the knee, and exhale, untwist, coming forward. And then from here, go ahead and bring both your legs out. And if you're on a blanket or on a pillow, go ahead and take that cushion off to the side, out of your way. So we won't need that until Shavasana. So go ahead and just move that all the way out of your space. And then from here, we're going to come into what's called boat pose. So this is a very energetic pose. So whenever we're doing things like plank pose, boat, or chair pose, what we're doing is really getting a deep tension. We're really holding activation into most of the muscles of the body, and then we can really soften and relax from there. So in boat pose, we come to rock to the back edge of the sitting bones. So with your knees bent, fingertips just behind the knees, roll the shoulders back, lift through the heart, and then find this point where you can rock to that back edge of the sitting bones and find a bit of balance, coming onto the tiptoes. And then from here, lifting one leg up, and then the second, trying to find balance. Now you're welcome to stay right here in boat pose, just squeezing the energy of the legs together. The other option is to begin to straighten one leg at a time, or possibly both legs. And then the other option is to release the arms and try to maintain this leg lift without the arm strength. So if you can, straighten those legs, engage the arms, reach up through the heart, really strong through that frontal plane of the torso. Lovely, inhale, and exhale, come forward into bound angle. So feet together, knees come apart. Inhale, lift the heart, and exhale, begin to walk the hands forward. Coming into a different resting forward bend. So here again, tucking the chin down, rolling the shoulders forward, and finding ease here to go inward and notice. Aware of the breath and aware of any thoughts in the mind. And then once more, press fingertips down to roll yourself up, bring the knees back together, and one more time into boat pose. So finding that point of balance, back edge of the sitting bones, lifting one leg, then the second, roll those shoulders back, lift the heart, and options to extend the legs, and perhaps release the arms. Lifting here, holding energy, feeling all of the body working, breathing. Don't forget to smile. When we look very tortured on the face, that can create stress in the nervous system. Inhale and exhale once more, coming into your bound ankle pose. So feet together, knees apart, lift the heart, and then walking yourself down into a forward fold. Aware of the heart beating strongly, heat in the body from that exertion. Just noticing. And then inhale, rise up. From here, go ahead and cross your legs at mid-shin, come forward onto hands and knees, bring the big toes together, knees a little bit apart, sit back onto the heels, and then slide yourself out into child's pose. So the options here are to bring your forehead all the way to the mat, or you might like to stack your hands or your fists to support the forehead a little higher up. You can have your arms in front, palms up for extra relaxation cues, or you can bring your arms back along the legs. So taking a moment here to ease into child's pose, drawing awareness here, able to notice the breath, able to notice all the sensation in the body with each inhale and with each exhale. And from child's pose, turn your palms down to the mat if they were turned upright. Hands are going to be shoulder width apart, fingers spread wide. And then inhale, rise up onto hands and knees into tabletop position. Adjust the knees so they fall directly under the hips. From here, inhale, lift your tailbone, lift your heart, start small and gentle with the spine. Exhale, drop your tailbone, pull the belly in, release the crown of the head, and then draw the hips back to child. Hold the breath out, a little kumbhaka. And then inhale, lead to the tailbone, rise up, coming to hands and knees, extend the heart forward, lift the tailbone. Exhale, flexion, pull the belly in, and sink it to child. Pause with the breath out. Feel free to move at your own breath rhythm as you inhale into your spinal extension, lift the chin, stretch the throat. Exhale, flexion, really pull the belly in and sinking to child's pose, pausing before the next breath. And one more round, inhaling into cow, really lift to feel stretch through the front of the throat, exhaling into cat, and back to child. Pause here just for a moment, aware of the breath, aware of all the sensation in the body. And from here, palms down to the mat, fingers spread wide, middle fingers parallel, setting up for down dog. Inhale, rise the table, curl the toes under, and exhale, lift your hips up and back to downward facing dog. Start here with knees slightly bent, really focusing on a long spine, reaching those sitting bones up and back, pressing the chest towards the upper legs, broadening through the shoulders and upper arm bones. And then begin to straighten one knee at a time as that heel presses towards the mat. Hold for a full breath before walking the dog to second side. Bend that first knee, straighten the second, holding for a breath. And once more each side, gently warming up through the back of the legs, into the Achilles and the calves, the hamstring. And second side. And then from here, bend the knees and hips. Re-lengthen those hips up and back, and then begin to straighten both knees as heels descend, coming into your full down dog position. Making sure the neck is comfortable, gazing back towards the feet. Pausing a little bit here for this inversion benefit as we draw blood flow towards the brain. And then from here, looking forward, inhale, and exhale, step or hop feet to the hands. Inhale, swing the spine out, and exhale, fold in Uttanasana, standing forward bend. In Uttanasana today, I'd encourage you to really let go of effort here. A gentle bend in the knees, perhaps swaying a little side to side, or even holding onto those elbows, a little traction to the low back. Making sure the neck is completely at ease, and just finding stillness here. So again, all of these inversion poses where the head is below the heart are thought to be very beneficial to our immune system. Okay, from here, check that your feet are hips width apart and parallel. Inhale, look forward, bend your knees and hips deeply. Exhale, swing your arms back. Pinkies are high, engage the triceps. And then inhale, rise up into Utkatasana, our chair pose or mighty pose. From here, roll the shoulders down away from the ears, lift the arms and hands energetically, drop the tailbone down, pull the front ribs back. Pausing here to engage those quadriceps, feeling some heat rise in the leg muscles and the arms. Breathe through the nose, keeping the breath flowing through the challenge here. And then next, inhale, rise, little back bend, reach the heart up. Exhale, coming upright. Inhale, reach. Exhale, turn the palms out, float it down, coming all the way down into mountain pose. Pausing here for a moment, just letting everything settle. Aware of the feet grounding down, heart reaching up. Breathing through the nose and feel the breath and the heart rate begin to slow. And now come toward the tops of your mats, and I'd like you to come into a high power posture. So low power is what tends to happen to us during fear or threat, or we have trauma. And so we can use yoga as a way to practice high power in the body. So this is research out of Harvard, where they had people stand in these powerful positions like a superhero, and in just a couple minutes, they can measure pretty dramatic changes in their cortisol levels dropping, that's your stress hormone coming down, and your testosterone levels going up, which is a hormone that gives you a sense of confidence and power and courage. And so hold some high power here. Lift through the heart, lift the chin, feel very strong in the body. Holding this strength, release the hands, palms forward. Little smile to the face, gazing out onto the world with a loving but strong gaze. Confident, empowered. And then from here, bringing hands up to those nostrils once more, partially restricting the nostrils. Inhale from nose to belly. Hold the breath in, hands cross at the heart, smile to the face as you slowly exhale. Hold the breath out. Hands to the nostrils, inhale. Pull the breath in using the strength of the diaphragm. Hands to the heart. Smile as you release the breath. Pause with the breath out. And one more time, inhale, nose to belly. Feel the diaphragm contract, hands to heart, and gentle smile as you exhale. Pausing with the breath out. Step your feet a little bit wider here. Release the arms. Inhale, big sun breath. Gaze upward, smile. Turn the palms out. Internally rotate the upper arm so the thumbs point down, and bring the hands to interlock at the low back. Roll the shoulders back, squeeze the blades together. Inhale, lift the heart, lift the chin, and exhale, begin to fold. Coming into your Uttanasana here with a little bit wider stance. And then begin to lift the hands away from the hips, really squeeze the shoulders together, release the crown of the head towards the floor, and really feel some deep engagement through the neck and shoulder region. Opening through the heart center and releasing tension through that neck and shoulder area where we tend to hold a lot of stress. And then from here, inhale, come up halfway. Release the hands to the legs, bend the knees. And then exhale, fold, leading from the upper hips, rounding the back, coming into your forward fold. And then from here, hands to the mat. Turn your toes in, followed by the heels, just bringing the feet in more narrow. Inhale, look forward, float your right leg up high behind you, and then exhale, step it back for a long crescent lunge. So you're going to need to make sure you have a little width between your feet here for balance. As you feel steady through the legs, visual focus as you come up to standing. So in crescent lunge, we have to balance. So we need visual plane of focus. We're staying high on those back right toes, lifting through the right hamstring, and we're trying to always square the hip. So pulling the left hip back, pushing that right frontal hip bone forward. As you feel stable here, hands to the heart. Your lunge position takes the knee just above the ankle. Loving gaze, looking out into the world, gentle smile to the face. And you can stay here or else inhale, rise, prayer hands floating upward, arms opening to receive good energy. Roll the shoulders down the back, lift the heart, lift the chin. Stay actively lifting through that back right hamstring. Engage the pelvic floor for more strength here. Visual focus, mental focus. Inhale, lift. Exhale, prayer hands to the heart. Hinge from that top left hip as you come forward, bringing your hands down to the mat, and then go ahead and step the left foot back to meet the right. Coming into our downward facing dog, so really reaching those sitting bones up and back, relaxing the neck, broadening through the shoulders. From here, inhale, float the right leg up high behind you, big stretch in three-leg dog. Bend the right knee, bringing the heel towards the glutes, and the spiral open. So really lifting that right knee high, gazing underneath the right arm. Make sure to not collapse the left armpit. So really lift through that left armpit region, bringing the left, big three-leg dog twist, opening the whole body. Square the hips and exhale, bring it forward, knee to the chest, shoulders over the wrist, and bringing the right knee down behind the right wrist for pigeon pose. So kick that lower right leg out somewhat on an angle and begin to walk the left leg back. Quick visual check to make sure that left leg is not jutting out on an angle. And then working to find a leg position to where you can bring that right hip to the mat. From here, inhale, lift your heart. Nice extension here. Starting with this nice stretch through the front of the torso. Inhale, and exhale, beginning to fold, coming forward. Bringing the forearms to the mat, perhaps stacking the fists to support the forehead. Relaxing here into pigeon pose. Letting everything go for a moment. Visualizing the breath creating space into that right hip with each inhale and releasing deep tension on each exhale. Softening the jaw, relaxing all through the face. Aware of any thoughts in the mind and encouraging them to pass by. And then from here, begin to come upwards. So bringing the hands to the mat, shoulder width apart, curl the left toes under, walk the knee in, bring the right knee back to meet the left into tabletop. Inhale, lift the tailbone, lift the heart. Exhale, pull the belly in, releasing down into child's pose for a rest. Pausing here just for a moment, letting everything settle. And then from here, reaching hands forward actively. Inhale, rise to table. Extend the right leg back strongly behind you, setting up for plank pose. Working to maintain this hip height, then bring the left foot back to meet the right. Plank pose always optional. You're very welcome to take a rest in child's. You may prefer down dog, or you can be on fists or forearms in plank to ease the pressure on the wrists. Otherwise, in full plank pose, we're engaging all the muscles of the body, pelvic floor, the core, pressing the heart away from the floor. And breathing, mind steady through the challenge. Deep breath in, knees come down, slowly begin to lower yourself with control. Allow the elbows to bend straight back, hug them in towards the side ribs, coming onto the belly. Go ahead and walk those frontal hips back, a little more space for the low back. Hands come forward, elbows tuck in for Sphinx pose. So here we have this straight line between shoulder, elbow, and wrist. Fingers pointing straight forward. Press to the pinky toe side of your feet, and then energetically tug the hands in towards you to lift the heart, lifting out of the shoulders. Feeling this nice stretch from the pubic bone all the way to the collarbone. Really reversing that forward curved posture that comes with anxiety. And you can stay right here. Otherwise, we're going to go a little deeper into opening the legs. Go ahead and bend that right foot or right knee to bring the foot upright. You can stay here, or you can lean to your left, reach back for that right foot, and then begin to draw that right heel towards the outer thigh. Square yourself back to face the front of your mat, and then lift out of that left shoulder. Pressing again that heel towards the outer thigh, accessing a deep stretch into that right quad and through the whole front plane of the body. Inhale, release that foot very slowly. Come back to Sphinx, and then rock to the right. Bend that left knee. Again, you can leave the foot just here, or you can reach back, holding the top of that foot, turning yourself to face forward. Lift out of that right shoulder as you draw the left heel towards the left outer thigh. Again, really feeling this stretch for that whole frontal plane on that left leg. And then inhale, release the foot gently, coming to Sphinx. Exhale, begin to tuck the chin as you come down, bringing hands to outer thighs. Roll the shoulders back, pinkies are high. Inhale and lift into locust pose. So again, another full body engagement pose here. Really keep those triceps working, hands are energetic, feet are energized, reaching out to the big toe ball mounds. Breathing through the nose. Feeling all the sensation arise in this challenging pose. Inhale, lift, and exhale, hands underneath the shoulders. Pause for a breath. Inhale, press yourself to table. Slowly let that spine neutralize before sinking your hips back to child's pose. Sliding yourself out, palms turned up, hands are heavy, open, relaxed, and releasing the head onto the mat. Pausing here to feel the breath, to feel the energy through the heart and the lungs. When you slow down your breathing with yoga, it opens you up to feeling every aspect of your body's sensations. It is a gentle, safe way for people to befriend their bodies where the trauma of the past is stored. Dr. Bessel van der Kolk. Slowing down our breathing is part of therapeutic yoga, a way to heal trauma and accumulated stress held in the body from our own direct challenging experiences, but also the shared story of humanity, collective trauma of humanity. Little smile to the face as you feel the heart slow. And then from here, begin to reach hands forward actively, setting up for down dog. Inhale, rise to table. Curl your toes under. Exhale, lift the hips up and back, finding your full down dog position. Deep breath in. Look towards the hands and step or hop feet to the hands. Inhale, swing the spine out. And exhale, fold. Uttanasana, standing forward bend. From here, set the feet strongly. Spread the toes wide. Bend the knees and pressure the feet as you sweep the arms up above you, rising up with a big sun breath. Prayer hands touch as you slowly exhale, drawing prayer hands down the midline to the heart center. Pausing here to notice full body awareness, sensation of the heartbeat, the breath, and releasing hands. Inhale, rise, big sun breath. Turn the palms out. Exhale, swan dive, coming into your forward fold. Pausing here in Uttanasana. Inhale, float your left leg up high behind you. Begin to bend your right knee as you step back for crescent lunge, second side. So again, a little width between your feet will help you have balance here. We stay high on those back left toes. And as you feel steady, begin to rise up. Find your visual point of focus, your drishti. Pull your right hip back, press your left hip forward, release the shoulders, hands in prayer. Lunging through that right knee so the knee falls directly over the ankle. You're welcome to stay right here. Otherwise, inhale, prayer hands floating upward, opening, receiving beautiful energy, little smile to the face. Really lift through that left back hamstring. Reach through the hands, relax shoulders away from the ears. Finding balance here. Mind is steady, breath steady. Inhale, lift. Exhale, prayer hands to the heart. Begin to fold from the top of the right hip, coming forward, bringing hands down to the mat, set up for down dog, and then step that right foot back to meet the left. Pausing here for a moment in your full down dog position. Broaden through the shoulders. Gaze toward the toes to relax the neck. And then from here, inhale, put the left leg up high behind you into three-leg dog. You can stay here or begin to bend the left knee, open up that left hip and spiral, gazing underneath the left arm, reaching that left knee high, foot is engaged, the right heel dropping towards the mat. Try not to collapse that right shoulder, but lift through the right armpit region. Big stretch here, three-leg dog twist. Inhale, straighten the knee, square the hips, and exhale, begin to come forward. Knee to the chest, shoulders over the wrist, and then setting that left knee down behind the left wrist, kicking the foot out, and begin to walk the right leg back. Again, a quick visual check to make sure that leg is not at an angle. Working on finding the optimal position for your left lower leg, working to get that left hip secure onto the mat, or else propping a blanket underneath the left hip. Start here in a gentle back bend on the fingertips, inhaling, reaching the heart upward. Really pull the left hip back, press the right frontal hip forward. Inhale, and exhale, begin to walk the hands forward into your pigeon forward fold. Options here to support the forehead onto the hands or the fists. Releasing here. Breathe into that left hip, visualizing each inhale, creating space, and each exhale, releasing deep layers of emotional tension held in the body. Gentle smile to the face, making sure the jaw does not transfer tension from that hip. Breathing, holding awareness to all the sensation this pose brings. And then inhale, begin to come up. Plant your hands shoulder width apart. Curl the right toes under, walk the knee in, and now bring your left knee back to the right for table. Inhale, lift your tailbone, lift your heart. Exhale, drop your tailbone, pull the belly in, and relax all the way back to child's pose, just for a reset position, keeping the arms active, palms to the mat. And then from here, inhale, rise to table. Extend that left leg back behind you. And then from the same hip height, bring that right foot back to meet the left into your plank position. Reach to the inner thighs, press the heart away from the mat. Gazing just beyond the fingertips so that the neck remains in neutral. And breathing. Of course, we balance the effort of these challenging poses with self-compassion to just know when we've had enough or we're not up for it today, and giving ourselves permission to choose an easier path if needed. Otherwise, we hold and breathe and smile, not allowing the face to react with negativity or the mind to react. All this is heat and sensation into the muscles. Great job. Inhale. You can bring your knees down to lower or keep knees lifted, tracking those elbows straight back, lower with control onto the belly. Again, walk those frontal hips back, hands forward, elbows tuck in. Pressing through the pinky toe sides of your feet. Go ahead and tug those hands in towards you to lift and lengthen. Really feeling this stretch deeply through the whole torso. Lifting the heart, lift the chin, feel some stretch to the throat region. Again, the throat, the jaw, an area in the body that we hold trauma. From here, you can stay in Sphinx, or you can just bend that left knee, bringing the foot upright. Our next level option is to lean to the right, reach back for that left foot, and then square our shoulders forward, drawing that left heel towards the outer left thigh. Make sure not to collapse that right shoulder, but lift. Really feel that stretch all through that left plane of the front of the left leg. And then inhale, release the foot, coming back to Sphinx, leaning to your left, lift the right foot up, reach it back for half frog, turning yourself to face forward, bringing that heel towards the outer thigh. And breathing here. Again, lift from that left shoulder. And on a slow inhale, release the leg back down, finding Sphinx pose. Inhale, really lengthen and lift. And exhale, tuck the chin coming down, hands to the outer thighs. Now you're welcome here to lift in regular locust, or if you want to do one more heart opener here, interlock the hands at the low back. Roll the shoulder blades down away from the ears. On an inhale, begin to lift, drawing the hands down away from you, up from the hips, active through those big toe ball mounds. Tucking the chin to make sure the neck is comfortable here, and breathing, really feeling that stretch through the heart center of the body as we squeeze the neck and shoulders. We tense in order to relax. Keep breathing, mind steady. Inhale, lift, and exhale, bend the elbows, coming down onto the belly, hand under your shoulders. Next breath in, press the table. And exhaling, sink the hips back to child's pose. Pausing here. I recommend turning the palms upward to really let go of effort through the hands. Gentle smile to the face as you savor the breath. Feeling the belly push into the upper legs with each inhale, and feeling a softening with each breath out. I think when the dust settles, we will realize how very little we need, how very much we actually have, and the true value of human connection. Unknown author. Feeling the heart slow, the breath slow. From here, reaching the hands forward, coming onto fingertips. Inhale, walk your fingers off to the right side. We're trying to breathe into the left side ribs here. If your neck is ever uncomfortable here, bend your right arm to support the forehead onto that right forearm. Otherwise, keeping both arms extended. Really reach that left hip back as you press the left fingers down and forward. Breathing deeply to stretch those side ribs, those intercostal muscles with each inhale. Inhale, walk hands to center. Exhale, lengthen the spine. And then inhale, hands walk to the left. Press the right fingertips down and forward as you reach the right hip back. Option to bend the left arm to support the forehead. Breathing here into the right side ribs. And on your next inhale, walk hands back to center. Lengthen the hips out on exhale. Inhale, rise up to tabletop position. Curl your toes under, and exhale, lift up and back to down dog. Pausing here for a full breath. Next inhale, look forward. Hopper step your feet to the hands. Inhale, swing your spine out, and exhale, fold. Standing forward bend, Uttanasana. And then checking that your feet are parallel, spread the toes wide. Begin to bend the knees gently as you release the arms. On an inhale, press through the feet, begin to rise up, gathering good energy, smiling towards the sunshine. Hands touch as you flow prayer hands down the midline, all the way to the heart center. Pausing here, holding awareness through the whole body. Perhaps releasing those hands, turning palms forward, roll the shoulders back, gazing out into the world, aware of the heart beating, the lungs breathing, strong energy flowing from the earth into the soles of the feet, rising through the whole body. Gentle smile. Next inhale, coming back out. Okay, we're going to cool it down, do some cool down stretches before our Shavasana. So if you'd like to put on a blanket, or sorry, sweater, or grab a blanket for warmth, you may like a pillow or fold a blanket under your head. And of course, an eye pillow if you can, fabricate one maybe out of a folded washcloth or something. Okay, so making sure you'll be comfortable and warm once we get onto the mat. But we're gonna come down with intention. So from where you are, step your feet wide, turn the toes out. Roll the shoulders back, turn the palms open, lift the heart, lift the chin, smile to the face, deep breath in. And then exhale, hands come to the sides, and we're gonna slide the hands down the legs. Inhale here, and then exhale, begin to press your left shoulder across towards the right knee, stretching the low back. Inhale, center, exhale, pressing the right shoulder across. Inhaling back to center, bring the elbows onto the knees. Inhale, pressing your left shoulder across. Inhale, center, exhale, pressing the right shoulder. And then from here, inhale, center. You may want to bring hands down, toe and heels come in before dropping into our yoga squat. So coming into our yoga squat position, again, your squat might be higher up, and that's perfectly fine. Otherwise, dropping those hips down, elbows to inner knees, hands in prayer. We squeeze energetically between the knees and the elbows, activating some hip stretch. Engage the pelvic floor, drawing those muscles in and up. Breathing deeply to access into the hip joints. Feeling that belly expand here with each breath in, the diaphragm drawing the breath to the lower lungs. And then inhale, reach the hands forward just for balance. Set yourself back gently. Coming here with feet to the floor, knees bent, hands come to the knees, rolling the shoulders back nice and strong through the front of the body. Before we begin to release the arms and lower ourselves down, notch by notch, moving slowly, resisting gravity, and just slowly releasing onto the back. For a moment here, just let everything settle. And then inhale, pick your right leg up. Bring the outer edge of your right foot to the left side. Inhale, and then exhale, pick that left foot off the floor. Hands are gonna weave behind the left thigh. Pulling that left leg in towards you, push the right knee away energetically. Keep the right ankle engaged, so we don't want to collapse that ankle. A little bit of an energetic 90-degree angle to that right ankle. And then keep pulling the left knee in towards you as you push the right knee away. Feeling a nice hip opener here in our thread the needle pose. Remembering to keep the face and jaw relaxed when we come into these hip stretches. And using the breath to visualize softening deeply held tension into that right hip. Inhale, step the left foot down. Continue to cross the right leg high on the left thigh. And then we're going to drop the knees off to the left for a cross leg twist. From here, we're going to turn our head to the right, away from the knees. If your right shoulder peels up off the mat, pick your left shoulder blade up, scoot it out to the left, and that will help draw the twist up the spine and have both shoulders secured to the mat. Pausing here to breathe into the belly, feeling some release through that lower right back. Inhaling, head to center. Bring that right leg up, followed by the left. Square the hips. Inhale, left leg up, outer edge of that foot to the right thigh. Inhale and exhale, lift that right leg up. Weave the hands behind the thigh. Begin to pull the right leg in towards you as you push that left leg away. And remembering to keep that left ankle actively engaged. Really feeling some sensation into that left hip. Finding our edge and imagining each inhale expanding space into the left hip joint, and each exhale softening deep layers of tension held in the body. And on an inhale, step the right foot down. Continue to cross that left leg high over the right thigh. Drop your knees to the right. Make sure both shoulders are on the mat. You may need to pick your right shoulder blade up and scoot it out to the right, and then turning your head to the left, away from the knees. Letting go here into a low back twist. Inhale, head to center. Lead to the left leg. Square the hips, square the shoulders, deep breath in. And exhale, both knees come into the chest. Really squeeze the breath out. Hold the breath out for a moment. Elbows to the mat, and inhale, legs come up. So hands come to the outer side just to support the legs. And then little bend in the knees, so there's very little effort here. And then just once more, point the toes like we started our practice with. Flex the feet, pressing through the heels, draw those toes in towards you. And then begin to roll the ankles just a few times each direction. And just encouraging some circulation to shift down the legs, coming towards the heart. And then finding stillness, just allowing the legs to hover. Again, this leg inversion position, one of our most effective ways to trigger our relaxation response in the nervous system. Inhale and exhale, knees into the chest, big squeeze. Inhale, step the feet down and begin to slide yourself out into Shavasana, perhaps taking a blanket under the head, a rolled blanket or pillow under the knees, and making sure you feel very comfortably warm. So of course, as I guide your relaxation time, I'll be in a sitting position, so please get comfortable. So it's worth that little moment to get yourself propped up, feeling supported, feeling warm and cozy. And that eye pillow, if you have something to place over the eyes, it's just an extra signal for the brain to just let go of all the effort and hard work and be able to really relax into more of an effortless place. So wherever you are in Shavasana, do draw the shoulder blades in towards the midline, feel very open through the heart center, really make sure the shoulders are away from the ears. Perhaps palms are turned up, or you might enjoy a hand to the belly and a hand to the heart. And you may also enjoy just a little bit of self-massage as you go into Shavasana, just massaging through the forehead, down the temples and the jawline. Maybe pressing underneath the cheekbones where we have some pressure points. Or just stretching the jaw, trying to make sure everything can let go of effort and relax. Come to the breath here, feeling the belly rise on inhale and fall on exhale. Work to slow the breath down, creating that little kumbhaka space, pausing at the top of each inhale, as well as at the bottom of each exhale. Allow a little gentle smile throughout the face, a bit of loving energy into the eyes, really allowing the eyes to just fall back heavily, completely at ease. And you may want to let the jaw stretch and relax, encouraging the tongue to fall back, letting go of all effort there. Holding awareness of the whole body, all the touch points where your body is in contact with supports beneath you. Aware of clothing and air touching the skin. Noticing any thoughts that arise in the mind, and just inviting those thoughts to pass by, sweeping the mind clear, coming back to present moment awareness again and again. Breathing in, breathing out, aware of the present moment. It is a wonderful moment. Feeling the energy of the body begin to settle, the heart rate slowing, the breath rhythm slowing. Perhaps the heat generated in the body beginning to cool. Everything settling, sinking into relaxation. With each breath out, relaxing deeper and deeper. Just this. Breathing in and breathing out. Softening all the muscles of the body. A gentle smile to the face. Allowing yourself these few minutes to go inward, to go a little more deeply into self-awareness, to notice how you are feeling, aware of any stress or anxiety being held in the body, and giving permission to your nervous system to let it go. In this moment, I am well, compassionate, deeply grateful. Breathing in, breathing out. Aware of every part of this moment. Just this. Begin to deepen the breath. Smile as you breathe into the heart. Soften as you breathe out. Imagining each inhale is drawing with it a beautiful healing light. That energy drawing into the lungs and dissipating out through the body, touching each cell, revitalizing. And now beginning to very patiently come back to the body. Very tiny movements at first as you wiggle the fingers and the toes, squeezing and opening the hands and the feet, rolling the wrists and the ankles. Moving freely as you come back to savoring body movement, body sensation. But it might feel nice here to take a big full body stretch, reaching those hands up high, toes point low, perhaps holding each wrist to pull up and over, little side body stretch. Or you may like to interlock the fingers and flip the palms of the hands away from the crown of the head, stretching the hands. And it might feel nice on an exhale to hug the knees back into the chest, really pressing the full breath out. maybe rocking on the back body, a little massage to the back. And you may like to do one last twist or even a happy baby pose to access those hip joints one more time. And then eventually roll onto the right side. So as we roll onto right side lying position, it's an awareness to notice sensation change, new touch points, new relationship to gravity, feeling circulation shift, and even noticing the breath flow more strongly into the left nostril, out through the right, a calming left nostril circular breath. And as you roll to your right side, using your left hand for support, begin to press yourself back up, rolling your spine up slowly, head comes up last, and holding that awareness inward. Take a moment to find a pillow or folded blanket to sit on, and establishing your sitting posture to close our class today. Always starting your sitting posture from a nice foundation in your leg position. Perhaps knees are wide, one foot in front of the other. Finding connection through those sitting bones, perhaps drawing the flesh of the thighs outward, leveling the pelvis, and then rising up through the spine. And then from here, palms turned up. Inhale. And exhale, draw fingers to the nostrils one last time. Next breath in, partially close the nostrils and do this Pratiloma breathing practice. Breathing in with slight constriction to the airway. Feeling the diaphragm pull the breath into the lower lungs. Pause with hands to the heart, smile to the face, and exhale. Pause with the breath out. Fingers up one more time, deep breath in. Slowly expand the lungs, hands to the heart, smile to the face. Exhale. Holding the breath out. And our last time, inhale, nose to belly. Hands to heart, smile, release the breath. And then bring hands into prayer. Pausing here in Anjali Mudra, holding some inner awareness. I'd like to share with you a writing by Paul Williams. When you go out and see the empty streets, do not say to yourself, it looks like the end of the world. What you are seeing is love in action. What you are seeing is in that empty space is how much we really do care for each other, for our grandparents, for our immune-compromised brothers and sisters, for people we will never meet. People will lose jobs over this. Some will lose businesses. Many will lose their lives. So take a moment, look into the quiet and stillness, and marvel at all of that love. Let it fill you and sustain you. It isn't the end of the world. It is the most remarkable act of global solidarity we may ever witness. So holding here, hands in prayer to the heart, recognizing the incredible acts of love and compassion and helpfulness throughout the whole earth right now. And in all that love, aware that there is also pain and suffering and loss. Honor that knowing. Breathe deeply into a sense that we are in this together. Knowing that we are a resilient species, a resilient society. And though we cannot predict how this time will go and unfold, know at the deepest level that this is something we must accept as a natural process in life. And know that all people are doing what they can to help us get through this as quickly and safely as possible. Deep gratitude to all the helpers Deeply grateful for all the love in the world. Take a big deep breath in, smile. Exhale, release. Again, deep breath in. Exhale completely. And one last time, big breath, smile. Exhale with release. It's always lovely to be able to offer this practice, to have others who want to share this experience with me. And I wish all of you wellness and all of you peace in your minds and your hearts. Thank you for being here with me today. Namaste. And just giving me a moment here, I'd like to just approach our recording, say thank you and goodbye. Thank you, everybody, for being here today. I hope this can be a healing space for all of us, you know, that once a week we can gather, we can talk about the reality of what we're all living through right now, and take this time to do what we can to not only heal our own stress and anxiety and perhaps ancient historical collective trauma that we hold in our bodies, but also as we do this practice, be able to send out this energy into the world to encourage others to have embodied experience of self-care and healing. And so thank you so much for practicing with me today. We'll be back with Mind Balance Yoga next week, and I'll be writing a new class. And next week I feel drawn to talk about death and grief. And so it'll be a new topic and a new subject for us to work on, but I think right now something that we really should be talking about and trying to find some way of moving through this difficult time. So thank you, everybody. It was lovely to practice with you today. Thanks for signing in. Namaste.